Dealing with constant bloat and chronic GI issues can take the joy out of life, and not being able to get answers from doctors can be so frustrating. In this video, I'll share the real culprit behind many GI symptoms called SIBO and the key tests for diagnosing SIBO and chronic digestive issues. Traditionally, when people see their primary care doctor complaining of gut issues, they will be examined and then usually sent to a GI specialist. Most doctors will then do a colonoscopy and endoscopy, which can be important and necessary in some cases, but really doesn't tell us what's happening at the microbial level in your gut. And just scoping the gut doesn't pick up important factors like food sensitivities, pathogens, or bacterial overgrowth, which can usually be the cause of many gastrointestinal symptoms. In fact, many people are struggling with issues like SIBO or small intestinal bacterial overgrowth, and doctors don't know it and don't test for it. So often, when patients' scope come back fine, they may give you a diagnosis of IBS, a blanketed diagnosis that's attached to symptoms, but not the cause of GI distress. This is why IBS is oftentimes a bit of a mystery diagnosis, and many doctors won't be able to tell you the true cause when your scopes and blood work come back fine. Or they may simply tell you that it's all in your head and offer you antidepressants, allowing gut issues to progress unmonitored. Chronic digestive issues is one of the most common complaints I see in my practice. The first type of patient I typically see has had chronic digestive issues. They've seen multiple GI doctors and they're not getting better. They've had colonoscopies, endoscopies, and have been treated with proton pump inhibitors like Prevacid or Prilosec. But they haven't had testing like we do to look at the gut microbiome and what's happening at the bacteria in their gut. So we'll do the test for bacterial overgrowth in your small intestine. This is done through breath testing. You drink a sugar solution and then collect breath samples over a 3-hour period. If you do have small intestinal bacterial overgrowth, these bacteria start producing certain gases in response to the sugar solution, and we can measure these gases in your breath sample. In addition to breath testing for SIBO, we may also do a DNA PCR stool test to look at your overall gut microbiome. This helps just to see if you have other infections like fungal overgrowth and parasites, and also gives us several important markers for digestive function. Inflammation in the digestive tract and markers for leaky gut can also be detected with this test. So we have 10 trillion bacteria in our bodies. That's 10 times the number of human cells. And if somewhere there is an imbalance in these bacteria, and if there is overgrowth of the wrong sort of bacteria, that can cause disease and cause a lot of symptoms. What we see often is that people who have been given a generic diagnosis of IBS or irritable bowel syndrome actually have SIBO or small intestinal bacterial overgrowth. In fact, 70% of IBS cases actually are SIBO and they haven't been properly treated. With SIBO, colonic bacteria ends up in the small intestine where they don't belong. This can happen for many reasons. It could be from too much antibiotic exposure in the past, or your diet was high in sugar and carbohydrates, or if you have a leaky ileocecal valve, which allows these bacteria to migrate to the small intestine, and they start growing in large numbers and start causing malabsorption and maldigestion. Our comprehensive approach to treating SIBO also includes helping patients upgrade their diet as well, because a lot of times poor diet and food reactivity can be the cause of gut issues. We mentor them so that they can get rid of SIBO, plus we may work with many other treatments to help them rebalance, like herbal, antimicrobials, and antifungals to clear out chronic infections, and nutritional supplementation to replenish nutritional deficiencies and more. It's also important to use the right sort of probiotics depending on your test results to get rid of this, because different probiotic colonies are necessary. We follow a 4R protocol. Remove gut irritants and foods that cause issues, replace nutrients, re-inoculate with the right probiotics and prebiotics, and repair gut tissue that was damaged. The other type of patient that I see in my practice who was much like myself, knew that they had SIBO and has Multiple other doctors, including functional medicine practitioners in the past, treated with herbal protocols and diets, sometimes even antibiotics, without successfully healing it. In cases like these, you must go deeper into the causes of SIBO so that it doesn't keep coming back. It's not necessarily one thing. There could be underlying toxicities going on, such as mold contamination or presence of heavy metals, and these can be the main drivers for chronic SIBO. There's something that has been missed, and that's why the SIBO is unresolved. So in these chronic cases of SIBO, we may need to test for things like mold and heavy metals, and if present, clear them out in order for the dysbiosis to resolve and for you to start feeling better. This has been part of my own journey, and I was forced to learn these things. When you don't get better and you have treated SIBO like I did 4 times, you know something isn't right. So then you realize, okay, there could be a whole other deeper level to chronic digestive complaints, and you need to look for these triggers. It's like peeling the layers of an onion. To go deeper on the key lab tests for SIBO, sign up for a free 15-minute discovery call where we can discuss your specific situation. Simply click the button below this video.